Okay, so we are down to the home stretch, and I chose this topic because I thought it would be interesting for those rare cases that we actually see edema, and they come to us, and we see, and I saw very seldom cases, and in my readings, I thought this would be a nice, interesting thing to throw into. Again, the financial disclosure, only potential risk is that I am an IVAS basic course instructor. So in edema, when it comes to the Western definition, it's whenever you have accumulation of water underneath the skin or in the body cavities. It's the same with TCM medicine. And within TCM medicine, it's that abnormal transformation of the fluids that then it overflows out of the channels, into the spaces, and into the body cavities. So it's pretty much the same thing. When you talk about the fluids within the body, there is a term called Jinye fluids, and this is a combination of the two types of fluids that are normal in your body. And these are the fluids that are secreted by the Zongfu organs. They are susceptible, so any type of qi or blood stagnation, any type of organ dysfunction, especially if the dysfunction involves the lung, the kidneys, or the spleen, the three organs that are the major organs for fluid metabolism, and the transportation process. And when they are influenced by the environment, external pathogenic factors, damp, humid environments, etc. So when you have Jin fluids, the Jin fluids are the thin, watery fluids that move quickly through the body. They move in conjunction with the qi and the blood, and they are metaphorically under the auspices of the lung function. And their duties are to warm, to moisten, to nourish. They are also the parts of the fluids that become sweat, tears, saliva, mucus, intestinal discharges. There is the Ye fluids. These are thick, viscous fluids, not to be confused with that thick, viscous fluid that you get when you're going through that filtration process and it's voided out through the feces. No, this is pure, thick fluids, and what they are located deep within the Zongfu organs, the bones, and the marrow. Their duty is to act as lubrication for that area of the body, the brain, the marrow, the bones, and also some of it is used to supplement the Jing essence within the body. So when we talk about the fluid metabolism, all the organs are involved with the transportation and transformation of fluids. The primary ones are the lungs, the spleen, and the kidney. And then, of course, the triple heater is the pipeline that all the fluids, as well as the Wan Qi, goes up and down the body. So the spleen, its responsibility is to collect all these pure fluids and then ship them out to the lung. And then the lung is responsible for disseminating the fluids out into the skin and the Wei Qi, with the Wei Qi, as well as pushing it downward to the kidneys. Then the kidneys are responsible. One, they're supposed to enable the lung in doing its job. So they grab the lung qi, pull the lung qi down to help the fluids to go downward, as well as the Wan Qi to go downward. A small amount is in a vaporized form to go up to the lungs to keep the lungs moist. But the majority is stored within the kidney and then converted to those fundamental substances, essence, etc., that we need whenever we need them. And then, of course, the triple heater then is the pipeline. So whenever you have excess fluids, normal excess fluids, the body then will get rid of that excess fluids either by using the lungs and pushing it out to the periphery of the body, and then it is voided from the body as sweat. And we all know sweating is accomplished by the opening and closing of the pores. And the opening and closing of the pores is under the purview of the Wei Qi. And so the lung and the Wei Qi. The lung disseminates the Wei Qi, the opening, the closing, it's all with the lungs. The other way to get rid of it is to shoot it downward, and then the excess fluids go out as urine. Whenever you have a deficiency of any of those primary organs, the lung, the spleen, or the kidneys, or you have obstruction within the function of those or within the channels, you can then get a backflow, and then you get the accumulation of the pathological fluids, which are listed here. Also, a reverse action. Too much fluids can also backfire and obstruct the channel flow, and also then you get that self-propagating cycle where the fluid production causes obstruction, the obstruction causes more fluid production, and then it goes into that cycle. When it comes to recognizing the type of patterns that you have in reference to edema, there is a lot of conflicting statements out there, and the reason is, just as I stated before, Chinese medicine kept on changing. More people, they had their own way of thinking about things, and so they defined pathological fluids as different. The physical process of how you got the pathological fluids were all changed, and so with all of that, the pattern diagnosis changed, and then the treatment protocols then changed. So the four that we're going to discuss are these four here, and the first two are very broad in categorization, and then the last two, they specifically will show the organ that's the dysfunctioning organ and the location that it's involved. So the first one is chi edema and water edema. So with chi edema and water edema, it's a broad. The chi edema is the non-severe form of edema, and it is caused by simply some type of chi stagnation or some type of damp accumulation. It obstructs the channels or obstructs the function of the kidney, the spleen, or the lung, and in these situations, the edema does not pit. You get swelling, but no pitting edema. And the skin color, when you press on that swelling, the skin color doesn't blanch and come back. So that is how you know you have chi edema. When you have water edema is when you have a deficiency. It is now some type of internal deficiency. It's considered a yang deficiency, so the spleen and the kidney aren't working well. And in this situation, the skin pits, so you get pitting edema. So now you know you have a more severe form. You know that the kidney, it's going to be due to some type of internal deficiency of the organ function. And then the skin will blanch. You push on it, turns white, take it off. The time it takes for the edema to disappear, that pitting to disappear and the color to come back, is an indication of how severe you have. The second one is yang edema versus yin edema. And in this situation, again, it's a broad definition. And with this, then, yang edema is due to some type of external pathogenic factor invading into the body, usually with wind, and the symptoms of edema closely follows the symptoms of disease. So it's an acute onset. And it's within days of, the edema follows within days of the symptoms of illness. This edema begins up in the head region, the face, the head, goes down, it'll involve the shoulders, and maybe then involve the arms, the front arms. And when it follows the arms, it typically follows the yang channels of the arms. And so that's the yang edema, the non-severe form. One of the reasons why, with the yang edema, because it's an external pathogenic invasion, it involves heat symptoms. So a lot of these patients will have heat symptoms that are related and listed up here. And with that then, this edema with these individuals, it is little to no pitting edema. So you don't have, and typically, the individual is typically a young, robust, healthy individual. And on top of that, because it enters as an external pathogenic factor, it is not uncommon for these individuals to have some type of symptom of a lung thing, like a little bit of a cough or some breathing issues. And that fits well with your 8 principle technique. When you have wind invasion, it usually comes in the top of the head, that wind cold, wind heat type of situation. So the severe form is called yin edema, And this one is due to an internal deficiency of organ function. One of those organs is not functioning well. The symptoms of edema is a gradual onset. So you'll have symptoms of an internal deficiency, and you'll have some signs of edema, then it goes away. Then you'll have signs more of edema, then it goes away. These individuals will, the swelling will typically start in the ankles and the legs first. So this is grandpa and grandma, or ourselves, that we've been sitting for a long period of time, and your ankles start to swell. And that usually occurs when you are an older individual. And so it's an indication that maybe you should do something, because it is an indication that you have some type of internal function with your kidney or your spleen, because you are having some problems with the transformation and transportation process of the fluids within your legs. So when you do that, of course, if you have a yang deficiency, these patients will show all the symptoms that you have with a yang deficiency. And so they're listed right here. So that's an indication then that you have the more severe form, as well as the scanty clear urine here is because the fluid is accumulating where it's not supposed to accumulate, and it's not getting to the bladder. So it's not getting to the bladder, so it can't be voided, which is why you have scanty urine, that type of situation. Because it's an internal problem, it is the one that shows the pitting edema. So you're going to have the pitting edema. Because it's an internal problem, it's typically the middle-aged to older patient, and it's typically or it could be a young patient who is overworked and overstressed, putting too much stress on the organ function. And it's usually associated with the spleen or kidney deficiency. So this is nothing really new to what you're thinking. It's just an indication of what you can then decide with clues of where if it's a severe situation or a non-severe situation. The 8th principal differentiation of how to choose the edema is a situation then where you are specific. So based upon what you see, it's going to tell you the location and the organ that is out of balance. And these patterns here, they overlap with that pattern that was yang edema. And they overlap with that because they're all acute in onset, and the edema is little to no pitting edema. So all of these right here are all the ones that are non-severe edema, little to no pitting, and acute in onset. So we are all familiar with exogenous wind. We all know what exogenous wind is. It's an external pathogenic factor. It invades into the body, and then it is usually involved with an upper respiratory infection or some type of superficial skin infection or some type of trauma. Surgery is planned trauma. So it's some type of trauma, and the edema closely follows those symptoms of illness. And that fits with that yang edema, where you have that acute onset, it's non-pitting, and then it involves that. So when it involves the exogenous wind, it's the same thing. Remember, the yang edema started up in the head. It involved the face. And then it would go down into the arms. And it would spread to the limbs as you got further and further down the road of being more and more affected by your body being affected. So damp accumulation, same thing. You get damp invading into the body via the pores. And this is external pathogenic damp that is from humidity or from long immersion into the water. And what happens is it interferes with the nutritive flow. And then once that damp keeps on accumulating, over time it can then cause dysfunction to the spleen itself. So it enters, causes more damp accumulation, causes chi obstruction, and then affects the spleen. So you get that self-propagating cycle. It is, again, a yang edema because the symptoms that follow. It's a non-pitting edema. It closely follows the symptoms of damp accumulation, and it's acute in onset. So you have somebody that's having some heaviness, some fatigue, some appetite issue, and then they are starting to show some edema, and it's non-pitting. So you now know it's a damp accumulation. When you do damp heat, it's damp plus heat. There's no difference. It's not, rocket science. You now know it's the same thing. And what is it? It's symptoms of damp plus symptoms of heat. This one is easy to recognize. Toxic heat in the skin. So this is when you look at a patient and they've got this suppurative inflammatory lesion and it looks ugly, and then the edema starts to follow it. That is toxic heat in the skin edema. And it is another acute edema. And what happens when you have toxic heat? You usually have a fever. You usually have a patient with chills. And so that's the 8 principal diagnosis for that. And then the last one is channel blockage. We all know about this. You get some type of damage to the body, to the channel, due to one of these reasons. It causes a blockage, and the edema is typically unilateral, follows wherever the damage occurred, and then it's typically distal to the injury. And again, it's a non-pitting edema. Those are the easy ones. When we have these, it is no different than the yin edema, where you have some type of internal deficiency. It's chronic in onset, meaning that the symptoms are ongoing. You get a little edema, then you don't. Then you get more edema, then you don't. And the edema ultimately becomes a pitting edema. And the patterns are very, very, sometimes a little bit difficult to determine the spleen qi deficiency from the kidney qi deficiency initially. They both have recurrent edema. They both can be all generalized. The issue, though, then, is the one where it's just involving the spleen itself. It usually will begin in the abdomen and involve all 4 limbs, but typically starting in the front limbs and then maybe passing to the pelvic limbs. And then when it gets really bad, then the pelvic limbs will be worse, but it started up front. When you talk about it, the other thing that will clue you in is that all the symptoms of the patient is involving a spleen qi or spleen yang deficiency. So all the symptoms that are in front of you, so you see those symptoms, you have the pitting edema, and it started in the legs, then you know that you have the problem is in the spleen qi yang deficiency. The thing that divides it from the kidney is the kidney begins in the legs and the lower abdomen. And it is when it becomes more severe, it starts to involve the face with that situation. One of the other things is you also will have the symptoms of kidney involvement, where you have the painful knees, the painful lumbar, all the things that indicate. One thing that's really nice is that I didn't realize it, but and it was an epiphany moment. When you have a spleen qi deficiency, you have physical fatigue. When you start to have the water element, the kidney involved in it, you are now having mental fatigue. So when you have a combination of mental fatigue and physical fatigue, you can pretty much start to say to yourself that the kidney element is starting to become involved. The other thing is in humans, when they start to see the humans start to have dark colored knee, because remember, the color for the water element is blue-black. So when you start to see blue-black coloration on the face or underneath the eyes or around the mouth, it's an indication that you are starting to have some kidney involvement. And I put this one on here, shortness of breath. How many of us, sometimes you say shortness of breath, you know it involves the lung, and you know that the lung and the kidney work together to help you breathe, but you're having this problem, and a lot of the patterns in kidney patterns say shortness of breath. And the reason they say shortness of breath is because the kidney qi is not grabbing the lung qi bringing it down to allow you to breathe. And so how can you determine which one to treat? And so I threw this in. If you have a situation where there is minor breathing problems, more than likely it's going to be the lung. When you start to have moderate to severe breathing problems, like asthma, then the kidney is starting to become involved because the kidney is not helping the lung to open up. If you have a robust patient with some mild lung issues, it's going to be the lung. If you have a very deficient patient or an older patient having breathing problems, it's more than likely going to be involving the kidney. So that's one way for you to determine which way to go. And if you don't know, you can do a little of both. In the older one, I'd focus on the kidney and then throw in a lung point just to help it out, that type of situation. So this pattern is a bit more specific. In these individuals, they are having edema in the head for most of the day, and as the day wears on, or as they exert themselves, the edema starts to affect the legs, the limbs. And the kicker is they will show symptoms of spleen qi deficiency. The heaviness, the fatigue, the poor appetite, they'll show all of those. So this is a specific pattern where you see it's called spleen and stomach deficiency. And the reason for this is because the fluid is accumulating and it's not being collected by the spleen correctly, so it's accumulating where it shouldn't be, and it's not getting to the bladder so that you can go ahead and void. And that's why you have that going on. So this, I put this slide up here for those of you that want a little cheat sheet. You have your diagnosis, that type of thing. And so it's the ones that are red and bold, you sedate. The ones that are in bold and black, which you don't have on this page, is you tonify. And the ones that are just black and you even needle. Now we all know, this does not mean you use every single point. These are suggestive points. So don't use every single point on here. Just use suggestive points to get your point across to the body. And then this is for the deficiencies. So I put those in. And of course, with the deficiencies, you're going to be tonifying a lot more than anything else. And then the other points that are in bold red, you're going to sedate. So now, the fun part, basing it on location. Did you want that picture? So, on location. So we have two renowned acupuncturists. They have a difference of opinion. So Machocha, he feels that if you have edema in the upper arms, upper body, arm space, eyelids, hands, then the lung, suspect lung first. If you have edema that starts in the middle of the abdomen, this area right here, and some of the limbs, then expect spleen. And then, of course, if it's below the waist and the lower limbs, ka-ching, it's going to be the kidney. However, McLean, his opinion is that I agree. The lung and the respiration passages is under the purview of the lungs. So if you have edema in those areas, I agree with you. But if the eyes and the eyelids have swelling and the hands have swelling, according to McLean, it's the spleen. So there's the difference of opinion. So you can choose which one you want to go with. And then, of course, they both agree in reference to the water, the kidney element. This slide are general acupoints. If you wanted, and you saw edema in the upper burner and face, those are the points that you would use to address the edema. It may not necessarily address the root cause, but it's going to address the edema in that area. And then the edema in reference to the waist, I went with McLean, and so it's the spleen and then with the kidney. So you can see those are the points. And the kidney, again, you don't need to use all those points. Those are just little options. In another section, if you have the eyelids, the face, fever, and cough, and edema, it's the lung. So you treat the lung. If you have eyelids and face and arms and palpitations, you treat the heart. So what is palpitations? Palpitations are essentially, it is not just a tachycardia or a arrhythmia. If you have that, you definitely have a palpitation. But there are a lot of individuals out there that they are having, from the definition, TCM definition of palpitation, it is an uncomfortable sensation of being aware of your heartbeat and your breathing. So essentially, I equate it to a panic attack. So people, when they'll describe one of two ways. They feel like their heart is going to explode, or they feel like their heart is going to stop. Another one, they feel like they cannot breathe, or they feel like they cannot stop breathing. The ones that are going, that type of situation. So that is classically the TCM palpitation. So if you see that now that's pretty difficult for us to see in our patients, but if you see that in a human, then you know it's the heart, it's the cause. Then when you go with the spleen and the liver and the kidney, it's really not that much different from what Machocha them are saying. The only difference is that specifically in this purview, if you have ascites and in the human, if you're prone and you have a difficulty to move or turn over, they say it's the liver. And essentially, they're saying that the edema is doing the cause of the liver. I was like, I'm like, okay, I'll just take you for your word, that type of situation. So what do you do when you have conflicting signs and symptoms? So you have a situation where you have edema in the eyelids, orbits, and fingers and hands in the morning for most of the day, but then later in the day, you get edema in the ankles. So what's the diagnosis? So the ones that are underlined are associated with the spleen, and the ones that are bold and red is associated with the kidney. You base your diagnosis on the plethora of symptoms. So what are the majority of the symptoms? They are pretty much, for most of the day, it's the spleen. And so the diagnosis is actually the spleen qi deficiency is the primary organ out of function, and you're now starting to see some kidney dysfunction. So the treatment would then be, you would go ahead and focus on the spleen and throw a couple of points in to help the kidney. And then for those of you, if bladder 23 and kidney 3, the combination, a top and bottom approach, is a very balanced approach. It can treat kidney qi deficiency, kidney yin deficiency, kidney yang deficiency, top and bottom. Because bladder, the shoe points are typically more yang in nature, and then the kidney 3 is a wan source point, so it's more yin in nature, so you're balancing the yin and yang, and you put them. If, however, you have a plethora of yin symptoms, then the point you should actually choose is kidney 6 with bladder 23. If you have a plethora of yang symptoms, yang deficiency, then you would do kidney 7 with bladder 3. Just a little bit of a nuance. If you don't really know and you don't want to hurt your brain, put kidney 3 and bladder 23 together and let them, and even needle those two together, and you will be able to treat the kidney issue. So what's the usefulness of this categorization? The usefulness is that with qi edema and water edema, they're broad. The first two are broad. So when you start to do your pattern diagnosis, you can go, where is the edema? So where the edema is going to give you a clue to the cause of the edema. Where did the edema begin? That's going to give you a clue to the cause of the edema. Is the edema localized or generalized? That'll give you an idea of the severity. Is it pitting or non-pitting? That'll give you a severity. Because if it's pitting, you know it's an internal problem. If it's non-pitting, the chances are it's going to be external pathogenic invasion, that type of situation. If you have a deficient patient, it's more likely going to be some type of deficiency going on. And then you want to look at all the other symptoms to zoom in on the organ that's out of balance. So what do you do? How do you treat this? Do you treat the pattern or do you treat the edema? So that is all based upon, is the patient going to die now? Okay? If the patient has a mild to moderate edema, your goal is actually to restore the function of the organ so that you can eliminate the edema. Now, of course, your edema is not going to be, the resolution of the edema is not going to be as fast. But because you're treating the source, your treatment is going to be longer lasting. So that's a conversation you need to have with the client. You're going to say, because it's a mild to moderate thing, I want to treat the cause. And when I treat the cause, we're going to get to the base, the reason why it's doing it. And as time goes on, the edema is going to go less and less. If the patient, however, is severe edema, or the patient is trying to die in front of you, Katie, bar the door, you treat the edema. You get rid of the edema as fast as you can. And you secondarily look at the function. Because trying to treat that underlying root cause, you don't have the time. You need to get rid of that edema first. So when we talk about herbs, when you use herbs, in all honesty, if you use herbs, you really need to have as close to an 8-principle diagnosis as possible. And the reason for that is because the 8-principle diagnosis quantifies qi, blood, yin or yang, and the element. When you use herbs, the more complicated the herb will get, the more it's addressing the qi, yang, yin, and whatever. So if you choose to give a yin-deficient patient a warming herbal formula, you have a yin-deficient patient who's hot, and now you're going to give a yang formula that's tonifying yang, you are creating a problem. So it's not to say that you can't use, if you're going to use herbs, you want to be able to know if it starts to look like a long drawn-out list, you might want to check for the contraindications that are involved with that herbal. But there are a lot of herbal formulas like Siwutang, which is good for blood deficiency, Lei Wei Wang, which is good for kidney deficiency, and you can't really harm any kidney deficient animal with Lei Wei Wang, that type of situation. When you use herbal formulas, the milder herbal formulas that get rid of edema in the mild form, they do it by sweating. They cause sweating in the individual to get rid of that excess water. When it's a moderate to severe edema, the herbal formulas are acting like diuretics. And so you're peeing like a racehorse. So that's how they get rid of it. And similar to the situation where you don't give a diuretic to a dehydrated dog or cat, you really don't give these diuretic herbs without making sure you're tonifying the body, that you're making sure that you're treating the root cause. You're just not throwing diuretics at them. So when you have the 2 herbal formulas that are go-to herbal formulas for any type of edema situation, is the Weepy San and Wuling San. Those, you can't hurt yourself too badly. But Weepy San is the gentler of the 2. It is the one that you use in the dog that's ready to die. It is the severely debilitated dog, this is the one you use, even though it's the gentler formula. And that's why you use it, because it is the gentler formula. And this is the one that they commonly use, and there's lots of case studies that show that it's commonly used in patients who are dog patients who are on furosemide enalapril for their pulmonary edema to get rid of that, and or ascites, that type of situation. The combination it acts similar to that. This prescription right here is if you wanted to have those same actions that Weepy San has, those are the points that you would put in. If you wanted to have the same actions as that. So you would put those points in. And the CV9 is the go-to human point that they use for any type of stagnation of water in the middle burner. And so that's the one that they use. That's the go-to point. By the way, it's also very good if you have a dog that has GERD or vomiting after eating, poor digestion. It's a very good point to use in reference to those diseases. So Wuling Song is the harsher of the two herbal formulas. And the reason it's harsher is because of these three. They promote bladder function, and it acts like a diuretic. And in that situation, because it acts like a diuretic, it is not really meant to be used long term, simply like long dongjigan. You use it till you get some control, and then you back off the dosage or whatever. It is also, you can use it with Western diuretics. You just need to monitor the patient very closely to make sure you don't make them get dehydrated. And again, those points that are listed mimic together, they mimic the action of Wuling Song. Now, the ones that are in red, they are FYI. Large intestine 6 is used whenever you have any type of swelling or upper edema in the upper part of the body. So anytime you have swelling or you have some type of face swelling, neck swelling, edema, face and neck, good point to use to get rid of the swelling. The other one is bladder 39. That one is good for any time you have accumulation of damp or edema in the lower body. It is also used when you want them to pee more. So you can use that to help them urinate more for those patients that are having problems urinating. So just an FYI and those kind of points to use. So when you're comparing them, you can use Weepy San by itself in the mild to milder forms and in the severe forms in that deficient debilitated patient. You can use Wuling Song for the mild up to severe. The diuretic effect is stronger, and it's not for long term. And in the really severe cases, you can use the combination of both of them to get some type of control, and then gradually take yourself away from the Wuling Song. And that's how you can use those. So for ascites, these are the herbal formulas that you can use for ascites. Now, obviously, this is addressing the edema. You still have to look at it to make sure that you are addressing the underlying cause. So when you have ascites, you then, the way they're listed is the increasing levels of spleen qi deficiency. So 4 gentlemen is the mildest. You have the mildest spleen qi deficiency going on. Then with the Jian Sha Lujinzwan, you have more damp and more phlegm. So the spleen is not as good and happy. When you start to see more yang deficient symptoms, then you use the Bujan. And the last one is in that, remember that pattern that had the edema with the stomach and the spleen not working well with each other? That's the one that you would use to help with the mild edema with those stomach issues that's going on. So the next one then, that's Weepy, Weepy San. W-I. It should be Wu. That's what you're getting at. That should be Wupi San. You got it. Typo. I stared at these slides too long. It's correct here. See, I got it correct there. Okay, so I have to correct that slide. Good catch. So with pulmonary edema, you can use Wupi San, you can use Wuling San, you can use the combination of the two. And then these are when you have a harsher form or more specific. So the next, the Zhenwu, the Zhenwu is called True Warrior. And with the Zhenwu, that is when you have either spleen yang deficiency, heart yang deficiency, or kidney yang deficiency. It's that animal that's really deficient and having that really bad, and they're starting to have that really bad edema and pulmonary edema. These individuals are yang deficient, which means they're showing a lot of the yang, cold body, et cetera, and they are, it's contraindicated in patients that are yin deficient. They're very warming herbal formulas. And because they're very warming herbal formulas, you don't want to make the patient too hot if they already have a yin deficiency or a body fluid deficiency. So it is very good formula for those heart patients, which I did use them for. But the change then is in this one, it's really good for dogs, but it is not so good for cats. In cats, they don't like the Fuzi that's in the True Warrior formula. They are a little bit reactive to the Fuzi. So in the cats, you actually want to use this formula. It's a better formula. They tolerate it better if you have pulmonary edema due to heart failure, et cetera, et cetera. And the other alternative is if you don't want to carry that specific one, you don't want to carry every single one, then you can use Wupi-san and Wuling-san. You can use those together and then gradually take yourself to a situation that you will then slowly get rid of the Wuling-san. So we have peripheral edema. And so when we have peripheral edema, these are the herbal formulas that you would use. We've already done that. And then these two, they're more specific for more severity of the edema in the periphery of the body. And the Zhisheng is it's for the mild, moderate peripheral edema. And again, the points show that mimic it. And it warms and tonifies the kidney yang. It gets rid of that pitting edema in the periphery. And it's the milder form. It does well with pretty much a lot of the patients. You still have to watch them closely. This one is when you really have severe pitting edema in the body, especially if it's in the lower half of the body and in a situation where you're starting to see a lot of GI symptoms and a lot of cold symptoms within the patient. And this is the one that you would use. And the combination of PC6 and stomach 25, that combination is actually a good combination whenever you have that fullness feeling of your chest and your abdomen, a Thanksgiving turkey approach. It's excellent points to help clear that feeling that your stomach and your chest are really, really too full, that type. When it comes to herbs with diuretics, then the situation is you want to, if it's a life-threatening situation, you can be more aggressive because you have to be. But when you need to moderate, in the mild and moderate things, you may want to start slow so that you don't have any side effects, that type of situation. Whenever you increase or decrease a dosage with these herbal formulas, you want to make small changes at a time. And additionally, if you are on a diuretic as well as the herbs, you don't want to make a change in both at the same time. If you're going to change, if you want to get rid of the Western diuretics, you decrease that one, you leave the herbs alone. And then if you want to decrease the herbal, you decrease that one, you leave the Western diuretic alone. So you toggle them back and forth. And just like in human medicine, well, not really, because in human medicine, we tend to give the medication and, grandpa still has the medication, but he doesn't have to need it, that type of situation. But whenever, in our patients, as you see your patient's edema start to go away, you need to make sure that you're going to use the least amount that's necessary. It's not needed to give them it forever, that type of situation, except, I guess, if you have a heart failure patient or something like that. And then, in summary then, you have this situation where the location is very, very helpful in determining the organ involvement. And that, I think, is the easiest way to where it is, because that's going to clue you in more for the organ involvement. And then what I did is I started looking at the other symptoms, signs and symptoms, that helped me indicate whether or not it was the spleen or the kidney, that type of situation. And then I would add in the herbal formulas. And then the herbal formulas, like I said, to me, they are a situation like acupuncture on a daily day. But with these herbal formulas, it's pretty much you're using it like a Western alternative. You're trying to get rid of that edema as fast as possible. And a lot of times, if you don't have it, you can go ahead and use the acupuncture points to mimic that action that I had them on there. So just put some acupuncture points in there to mimic the action, so that owners don't want herbs, so they want acupuncture. Use the acupuncture points to mimic the action of trying to get the edema out of the body. And so the biggest and most important thing in actuality is that you want, in the mild to moderate edemas that you're seeing, you really want to address the underlying cause. And if you address the underlying cause, you'll have a longer lasting effect, and the edema is not going to keep on coming back. And then if you have a severe and life-threatening situation, then you want to drain the edema as fast as possible and then treat the underlying cause. And so it's like anything else, this is, I feel, treating the edemas is true integrative medicine, because you're choosing both to do the Western and the Eastern together to get the handle on the patient. And I like it. And the unfortunate thing is, the majority of the times that we see them, it's usually when they're on death's door. We're their last-ditch effort, and they've seen everybody else, and now we're supposed to help them, and then we're sort of kind of digging ourselves out of a hole, that type of situation. That's the patient that you Katie bar the door. You tell them, we have to get this clear, and we're going to do this. And you start being aggressive to get rid of the edema that's going on in the patient. And so I went through this quickly. I think I have lots of time left. But I don't really know, because I didn't put the timer on in reference to my computer. Oh, good. I was on mine. Okay, so are there any questions? To me, it's Cliff Notes. I mean, you got them in front of you, so you see the edema, you're going to go, okay, this is the one I'm going to use. I mean, really, that's the reason I used it. And this is the kind of lecture that I like, because I go, pulmonary edema. I know, I've got those notes. Let's go back into it, so I don't have to fix my brain, which is why I chose this topic, so that you have it at least in that few cases you get. You don't have to go through your books and try to figure it out. Okay? That's it. Yay.